Afternoon, everyone. This is Dr. Avani, consultant reproductive medicine, Apollo Fertility, Hyderabad. So today topic PCO to just throw important points to tell you an important points on PCO. So these days we listen or hear this word PCOS or PCO or PCOD more frequently. So let me start with telling what is PCOS or PCO. So PCOS is polycystic ovarian disease or polycystic ovarian syndrome, where we see multiple fluid-filled cysts in the bilateral ovaries. So this is the most common endocrinopathy which affects the reproductive age group in women. So the prevalence in India is around 3.7%, and in adolescents also it is seen that nowadays because of the bad lifestyle, around 3%. So now coming to uh, what, what are the symptoms we see in polycystic ovarian syndrome or PCO? So the most three common symptoms we see are menstrual irregularities, that is irregular cycles, which can be frequent cycles, that is less than 21 days, or prolonged cycles more than 35 days. And next is hyperandrogenism, where excessive androgens are present in the body, and the symptoms which are shown in the form of acne and male type of baldness and alopecia. Alopecia is like hair loss. So, and the other third symptom which we see is polycystic morphology of in the ultrasound of the bilateral ovaries. So the next coming to what causes this PCO. So there are large number of. It is believed that it is of multi-genetic etiology, and the non-genetic factors such as a poor lifestyle, not maintaining a healthy weight, diet, and exercise also have a strong mm, role in getting this disease. So, how do you diagnose PCO? So, as I said previously, the symptoms which are associated with PCO is mostly used for diagnosing the PCO, and it was diagnosed. I mean, it was first described by in 1913 in 1935 by Steen and Leventhal, and since then we have been listening to lots and lots of innovations in this. So the most common thing which we see in the diagnosis of PCO is, as I said previously, it is menstrual irregularities or excessive androgen symptoms, and in the ultrasound, PCO morphology. That means multiple cysts which are seen in the ovary. So now coming to the types, we have seen obese PCO as well as lean PCO. So the obese PCO, the name itself indicates that they have high BMI, and they are more prone to the metabolic disorders such as type 2 diabetes, cardiovascular risks, vascular risks, and so forth, along with the other symptoms. And the lean PCO, where the BMI is less than 25, and they are also affected with all these symptoms of PCO. Now coming to the pathology. So what happens generally, normally, when a woman is not having PCO is uh, patient the woman develops one egg every month and it's released. So in a cohort of follicles in PCO, what happens is there is an imbalance between the hormones, and there are multiple follicles, and single dominant follicle is not recruited, and there is arrest of the follicular growth because there is an excess of androgen, LH, and all different hormones which are not supposed to be in such high level in the body compared to the normal woman without PCO. So, uh, so another important thing which we have seen in PCO patients is the insulin resistance. So what is insulin resistance? Insulin is produced in the body for the glucose metabolism. So in these patients, there is resistance and inadequate utilization of the glucose, inadequate use or utilization of insulin for the glucose metabolism in PCO patients. So there is insulin resistance. So this is the main thing in PCO patients which we have seen. So now, there is glucose intolerance, and so what is the coming to the etiology of insulin resistance or the causes of the insulin resistance? It's like it's genetic, and um, as I told you, excessive insulin inadequate tissue utilization of the glucose metabolism. So most of the patients. Okay, I've got a question here. Sorry for the disturbance in the session. What precaution should be taken to avoid PCO? That's a very good question. As I previously told, it is a multi-genetic origin, and maintaining a proper weight and good lifestyle with dietary modifications is very, very important to avoid PCO. So you have to maintain an ideal BMI, and your diet should include healthy diets such as green leafy vegetables, avoid sugars, outside aerated drinks, frozen food, and minimum exercise of half an hour to 45 minutes. So that you maintain your ideal weight and BMI, and you can uh, try to avoid getting PCO. So majority of PCO patients are obese, but few percentage we have seen lean PCO. That means thin PCOs where they are presented with the same symptoms or they do not have any symptoms and they come to the fertility clinic. Then they are diagnosed with PCO because they are not obese. So what are the associated medical conditions which we see along with PCO and which the PCO patients are at risk of? That is. Where they have high lipid profile, and so if they're also with the metabolic syndrome and uh, and vascular complications. So as and because of high androgens condition in PCO, you see hirsutism, that is unwanted hair in the women, and acne, as well as male type baldness, as well as alopecia. So now coming to the what other conditions you have to know before. Okay, as we're talking, another question we have is what level of severity can PCO cause? So, as I previously told, there are different problems associated with PCO. It is hormonal, metabolic, as well as fertility issues. So now, as we're talking with PCO and fertility, I would like to highlight on the fertility part. As I said previously, a woman who does not have PCO, a single follicle is developed every month. A person who is having PCO, as because of the abnormal hormones in the body, the egg do not develop, and mostly they are seen with, not everyone, mostly they are seen with anovulatory cycles. That means the egg is not, the dominant follicle is not developed, and in turn, it causes fertility issues. And I have another question. I'll get back to the question. Let me answer this question. Then the second thing which we see is menstrual irregularities, and also they are associated with metabolic syndrome such as type 2 diabetes, cardiac diseases, and uh, vascular diseases. So if you're looking for fertility part, but the first you have to take care of your health, ideal body weight, and as well as um, visit a doctor for the fertility. So the other question we have is, if I have PCO, is it compulsory for me to undergo IVF? That is a very good question. And no, if you have PCO, it is not compulsory to undergo IVF, as we have few patients who do not even know their PCO, and when they come for the checkup, and they have normal ovulation and they conceive. But it is, we have to combine all the blood tests, your scan, your symptoms, how severe the PCO is, how are the hormone levels, all these, and how long you have been married, what is your age, and your, it depends on your the sperm factor, the husband's sperm factor also. All these will decide what type of treatment is required for you. And the answer for this is no, every PCO doesn't require IVF. There are few PCO where there is severe, and there is severe PCO and the hormones are very abnormal, and they have tried all the treatments and it's failed. Then it's a more than 5 years married life and they have taken a lot of medications. Yes, they might consider IVF, but it depends. After we check you thoroughly, we will, the fertility doctor would decide whether you fit into IVF or yes, the smaller treatments can be done. So coming back to my continuation of the lecture. So now coming to the management of PCO. So in all these patients, the most important thing we have to tell the patients is maintain an ideal BMI and have a healthy lifestyle. So when I say healthy lifestyle, it is a it comes in terms of diet, exercise, and proper sleep, stress free life. So this all have a factors which would help you or enhance your fertility in terms of PCO. So when coming to the healthy lifestyle, diet means you have to have multicolored in your plate. In your plate, there should be greens, there should be fruits, there should be sprouts. So there should be fresh leafy vegetables, fruits, vegetables. Please avoid excess of sugar, excess of fats, carbs, frozen items, and outside junk food. So that, and make sure the exercise is part of your life, and it will help to enhance your fertility chances in PCO. It's, this is not only for PCO. Every person who is planning to conceive, this life, having a healthy lifestyle is the most important thing you have to follow. And the next, please visit a good doctor where they will see in which range you fall, how are your hormones, what all you should do, and what are all the medications you should follow before starting. So as I said before, previous few patients can ovulate by themselves, so they need not have any fertility treatments for that. So that has to be checked. First, we when for the first time, let me explain, just taking a case. So let's say a 23-year-old who is just married for 1 year, who has irregular cycles, and her BMI is around 30, and she has come to the clinic. So she has been just trying for 1 month, and we don't just jump and treat her with IVF for other treatments. So first thing is, as I said, we have to assess her, we have to counsel her regarding the diet management, lifestyle management, reducing the BMI, and all her hormones. And first we check whether she's ovulating by herself. If she's ovulating by herself, then she can try without just taking the supplements which are useful for PCO. She can try naturally and wait for 3 months. If she doesn't conceive by then, yes, she requires some assistance. So in the same way, few patients are there who get cycle only on taking medication. A few people get it after 35 days, but few people, they do not get menses up till you give medication. Sorry to interrupt. And there is another question where SN, that can endometriosis lead to PCO? No, it cannot. But we have seen coexistence of endometriosis as well as PCO in few patients. So coming to the management, as I said, the lifestyle management is most important. Depending upon your complete profile, your hormones, we would like to first, will PCO go away after menopause? Um, PCO patients may have delayed menopause. Yes, it might go away. So you will be tested thoroughly, including your husband, seeing the sperm parameters, as well as your how is the PCO, and we will start the treatment. So coming to the what treatment has to be started. There are multiple pharmacological agents, and it depends on your condition and your individual. The treatment is individualized. So now coming to the ultrasound features, both ovaries are enlarged and you have more follicles which are arranged peripherally, and so there are different types of drugs which we pharmacological agents which we use, like minoxidil and metformin, which are useful for PCO. And now I just want to throw a light. Recently we had so adolescent PCO, which is very important, and the management of PCO has to start from adolescence. So the ISHRI guideline says if the teenage girl is having periods or the cycle uh, 45 every 45 days, please do not intervene, and she no need to give hormones and all. But if it is prolonged, you can give oral contraceptive pills. So, what are the long term? I would just give a message to the young adolescents who have matured or attained menarche, is like they should be advised to adopt a healthy lifestyle, and they should be encouraged to have a good diet, and counsel her that the increase of weight is not advised. So now coming to the problem we face in fertility with patients having PCO. So the first and foremost which we see is the as I previously told, is the ovulation part, where in most common we see is anovulation, where the egg does not develop by herself. So then we should give the pharmacological agents. And so different, what is the first line of treatment is trying, depending upon the age of the patient, depending upon the number of years they're married and how long they have been trying. So the first line of management is ovulation induction cycles, and they'll be monitored whether the pharmacological agent is useful for her or not. And later treat second line of treatment is the IUI, and the last is the IVF. So I don't want to go into the details of these pharmacological agents. So now, most and foremost management, where we say when should you undergo laparoscopy or surgery for PCO, where the drilling is done. So laparoscopic drilling is basically using electrocautery or burning the multiple cysts which are present in the ovary. So what are the indications where we can use laparoscopy? So this is not the first line of management where you directly go and do drilling or the PCO cysts which are burnt. So generally, we have to do laparoscopy when all the medications have failed and it's not ovulating, and too many follicles are seen, where before IVF we require them to be burnt. These are the main two indications where we do laparoscopy. Or and also we want to assess the tubes, and also deal with the PCO where it is severe and is not responding to the medications. This is diagnostic lab, where you feel that the ovary is very much enlarged and it requires PCO drilling. So, so see another, what complications we see when we are dealing with PCO. The most and foremost complication we see when you're treating fertility part for the PCO patients is we see hyper response of the ovaries as their it's exaggerated ovarian response or hyper response. And uh, and also the endometrium does not synchronize. The endometrium is the uterine layer which does not synchronize with the ovulation, and so implantation also may be a problem. So these are the complications which we see with the PCO. So so um, yeah. So we in PCO, as I said, the most common is the hyper response. So we have to discuss with the patient and have an ideal dose. It's individualized before IVF cycle. So now the commonest question which we have is, what are the indications for IVF in PCOD patients or the PCO patients? So, as I said previously, it depends on how severe the PCO is and how many years of marriage, how is the sperm factor, what is the age of the patient, and what are the previous treatment she has undergone. So it is difficult than with the it is the PCO patients have little difficulty in conceiving rather than the patients who do not have PCO, but it is not impossible for them to not to conceive. So we have to take care, but pre IVF, we have to ask them to have a proper lifestyle, healthy lifestyle, reduce the weight, and also take all the supplements which we have been prescribed. And there is nothing to fear that if you have PCO, you won't conceive. There's nothing like that. And it has to be a it's a team approach where the dietitian is involved, endocrinologist is involved, the physician is involved, depending upon their sugar levels, their lipid profile, their BMI. Everything has to be a collective treatment from everyone, along with the fertility specialist. So there is another question where it is the how does PCO affect by metabolism? So, as I said previously, the most common thing we see in PCO is the insulin resistance, where the inadequate tissue utilization of insulin for glucose metabolism is seen. So, because of this, because of the insulin resistance and altered lipid profile, insulin resistance, altered lipid profile, you see and obesity, and we see there is hypertension, type 2 diabetes, and atherosclerosis, high sugar levels, and there is vascular complications also. So we have to maintain an ideal body weight in order to prevent this metabolic syndrome, which we see commonly in PCO because of the insulin resistance. We have seen high sugar levels associated PCO in obese PCO patient or lean PCO patient. We have seen high sugar levels because of the insulin resistance, and what do you call glucose metabolism is altered. So type 2 diabetes is seen in patients with PCO. So when should you meet fertility specialists is the next question. So when you're diagnosed with PCO first and you're planning to conceive, please go and meet the fertility specialist so that they'll be able to tell you whether you can wait further, or we need whether the fertility treatments have to be initiated, and you need treatment for your dream to come true, that is conception. So there is nothing to fear or get stressed when you're diagnosed with PCO, because there are quite a lot of people who have conceived with assistance and assisted reproductive techniques, and you do not worry and get stressed because you were diagnosed with PCO. So we have seen much incidence has increased nowadays of PCO as the life, because there is sedentary lifestyle even in the adolescents. They do not have exercise or play time, and they are stuck to gadgets. So we have seen an increased incidence of PCO in every age group, and it is we have to take care of ourselves before it becomes more severe in the population. With ideal treatment and proper counseling, the woman who's having PCO can conceive, and there is not it's not an impossible thing that they cannot conceive. So, as there are no further questions, I would like to end the session. Thank you so much for listening. And you have any queries, you can contact us, and we will help you with all. Thank you so much.